Hi guys, how you doing? This is Lucia. So I decided to make a video to let you know what happened with the visit I had with my surgeon. So I went to Dr. Uliak on Thursday in Orange County, and you guys know I live in San Diego, but he did my lap band, and I'm gonna, go back to him. If I ever had any, gastric problem, he is my guy. So we got there, we set up a date for the surgery. So my surgery will be on January 4th, 2016. And we did not make a decision on which type of surgery I'm gonna have. We don't know yet if it's gonna be the sleeve or the gastric bypass, and I'll tell you why. So the sleeve, it's gonna give me, or gives patients, the better outcome on a sense that is less risk long term. He said that the weight loss, on his experience from his patients, it's basically the same between the sleeve and the gastric bypass. However, the gastric bypass has been around like for over 40 years, and so there are studies and research done on long-term outcomes of the gastric bypass, and whereas the sleeve, it's a relatively new surgery, so there's not enough body of research about long-term outcomes for the sleeve. So what we know based on research evidence is that the gastric bypass has a greater effect on reducing diseases such as diabetes, high blood pressure, back pain, and there's a list of diseases. And so here's where we do not know which surgery we're going to do. There's two reasons why. So first reason is, since I have a lap band, it's been there for 4 years, the anatomy of my stomach changed because it's being squeezed, and he had to suture a part of the stomach over the band so the band wouldn't slip. So the stomach is just like, it's changed its anatomy. So by the time, since I can't have two surgeries, one to remove the band, wait 3 months to get the stomach adjusted, and then have the second surgery, to do the sleeve, maybe the anatomy and the shape of my stomach now would not allow my stomach for him to do the sleeve. It might be looking weird, not work properly, and might have leakage. So this is one concern. Second concern that made us feel about, and backing up, if this happens with the stomach, the gastric bypass is a less chance that, fewer chances that it would have a problem because of the shape of the stomach. The surgery itself kind of helps in this way. Second reason, which is the biggest one for us, is that since I was mentioning gastric bypass has greater results on reducing diabetes, high blood pressure, etc., that might be something for me. I am not pre-diabetic. I do not have a high blood pressure, but both my parents have. Well, my parent passed away last year, but they both developed diabetes type 2 in their 40s or 50s. I always thought that diabetes type 2 is basically developed just because of weight. But after I took a year of clinical medicine, I realized, no, actually, diabetes type 2 is a genetic predisposition, and you can inherit that. Since both my parents have it, I have it in my genes, like at least 50% of the chance, or even more, that I can develop diabetes type 2. So that's when my doctor was just like, really didn't know what to do. He said, well, I usually would tell you how the same he did last time I saw him, how to get the sleeve. But when I presented him with this, history of diabetes in my family. He was just like, well, maybe there's something that we have to think about. So what he decided to do is, like, he asked me, which I would have to do anyway, an upper GI. And so with the upper GI, he's going to see what does my anatomy, my stomach, the digestive system, how the digestive tract is looking right now. So then he's going to make a decision about which surgery is best. We're going to meet again on December 22nd or 23rd. I'm not 100% sure the day. That will be my final meeting with him before surgery. So by that time, we will definitely make a decision. So again, I don't know what surgery I'm going to have. So it will be really dependent on that. So here's my take on it. Like, if it was mainly based on I want to lose weight, I would probably go with the sleeve because it's less risk long term. I mean, the biggest risk is the first few weeks, maybe within the first couple of months. There's the risk of leakage because it's a bigger area where, you know, big portion of your stomach is removed, and so there's the stitches over there, so you have to be really careful not to stretch your stomach, the stomach that is left too much, because it could be, you could have leakage from the sleeve. And long term, that's really not much risk evidenced with the sleeve. The gastric bypass, there is the advantage of it's a faster weight loss, and evidence right now there is less risk of regain after. There is some regain for many patients, but studies have shown that there is a greater weight loss and maintenance of weight loss with the gastric bypass. But again, as he said, gastric bypass has been around for over 40 years, so they have that data that is available. They don't have the same sort of data available from the sleeve, so it might be the same results, so we don't know yet. But now the risk for the gastric bypass are greater. So the sleeve, it's mainly restriction surgery, and the rest of your digestive system just keeps the same. So you still have the digestion, you have all the gastric juices, you know, everything is intact. It's just a smaller stomach. With the gastric bypass, you kind of bypass some functions of the stomach, and it is a malabsorption surgery as well. So you have a greater chance of having iron and calcium deficiency. And I have asked him about anemia. So he said, well, for younger women who have their periods still, there's a lot of like monthly blood loss. And that is a bigger risk for anemia because there's a lot of iron that women lose with the bleeding. I had a surgery that I had to do in 2013 that I don't have my periods anymore. So it was a condition that I was having at the time, and I had to make a hard decision to have the surgery. My my system, it's all still intact, but the surgery was done in a way that I don't have the bleeding anymore. So he said, in my case, I would not have that risk of anemia as long as I was taking my supplements, you know, and that would just like be easier. And that's, you know, one of the main problems that would be with the gastric bypass. So yeah, I don't know. I am still really divided on what I want to do, and I'm gonna still be thinking about it by the time I meet with him to make up my mind, you know, pros and cons, you know, the risks, and try to make up my own mind on what I want. and make that decision upon, research that I'm going to continue making. I'm going to read more articles and research and studies about that and see, what is it that I can find about it on my own to make up my mind. So that's what we decided. We did not decide about what surgery I'm going to have. And then I asked him, so, well, can you unfill my band completely? So I have a 10cc Allergan lap band, and I had 6.3 cc fill in it, and now I have 0. Well, I mean, I probably have 0.3 because he was able to take out 6 cc from my band, so it's completely unfilled. It's there. And it was interesting, like when he was taking it out, I could feel my stomach kind of moving around inside, and I could hear, like, sounds of it. And so it was interesting, but I was just like, okay, hunger wise, it didn't change a thing. I mean, I still feel, the same. I don't feel that much hungry at all. But because of the band I had was, this restriction was so much, I had to eat very little. I was really careful what I ate. I would get stuck with some types of food. So I was, after I left his office, I was just like a bit still, okay, what can I cannot do? And since I was in Orange County and I'm a huge Disneyland fan, I decided to spend the rest of my day at Disneyland waiting for the traffic to slow down to be able to drive down to San Diego. And I decided, okay, there's one thing that I was never able to eat. Not never, but it was a food that is always a high risk of getting stuck, is hot dog. So I ordered a hot dog. I still didn't eat the buns. I just ate the hot dog. But it was much more comfortable. I was able to eat, and then, I said, okay, I'm going to drink a little bit and see how my body reacts, and it didn't so it felt so much comfortable, So this is one of the reasons why I also was thinking about, oh, maybe the sleeve is the better option, because he told me, and some of you also told me that there is restriction with the sleeve. I know that I've heard some people say that they have some stuck episodes with some foods with the sleeve, but not only my surgeon, but some of you told me that there is some stuck episodes with the gastric bypass, and I'm like, oh, I really want to have a more normal way to do things, so to eat and not having those symptoms. It's just like really upsetting. So I don't know. I don't know. I got into his office yesterday thinking, yeah, I'm more, tending more to the gastric bypass, but after I felt this relief with the band, I'm just like, oh, maybe the sleeve, it's the best. So I'm just like, I'm all divided, not knowing what to do. So that's it. That's that. I went there, and he asked me, as I was expecting, to lose 10 pounds until surgery. The last time I was there, I had about 2.5, well, last time I was there, when I had my lap band, I had close to 2.5, 3 months to lose 10 pounds. And I was heavier, so it's a little easier to lose 10 pounds when you change your habits, right? And I'm already kind of not eating that much. So 10 pounds, to lose 10 pounds in about a month and a half, it's a lot. But especially, Thanksgiving coming around and Christmas coming around, I'm going to have to be really careful paying attention to what I eat. So I was talking to him like, I hope I can get this 10 pounds down. And he said, well, as long as you don't gain weight and you lose something, that's going to already be helpful. I'm like, fine. So I am going to aim to lose the 10 pounds. So I've been there on Thursday. So I was 28.6 or 8. I can't remember. Well, I wasn't on his scale. And I'm at 27 227 right now, so it's about 1 point some weight lot 1 point, I don't know, 6 pounds lost in 2 days, so it's good. So let's see if I can lose 10 pounds. I think I can in about a month and a half. So that's that. I will try to come back either today or tomorrow to make another video about my ideas and my plans for this channel, and I will talk to you guys later, and I'll keep you guys posted and updated on my weight loss and my preparation for the surgery. Okay guys, I'll talk to you guys later. Bye.